What makes mesothelioma such an aggressive lung cancer? Imagine a cancer that grows quietly in the lining around your lungs before it suddenly becomes hard to control. That's what makes mesothelioma so aggressive. It starts from the mesothelial cells, that from the thin lining called the pleura, which surrounds the lungs and chest cavity. Because it originates in this lining rather than the lung tissue itself, it behaves differently from other lung cancers. One reason mesothelioma is so aggressive is how it spreads. The tumors tend to grow along the pleural lining in a diffuse manner, causing thickening that makes it hard for the lungs to expand properly. This leads to symptoms like shortness of breath and chest pain. The cancer often forms multiple nodules and quickly invades nearby structures such as the chest wall, diaphragm, and mediastinum. It also tends to invade lymph nodes early on, which helps it spread within the chest and even beyond. This invasive and multifocal growth pattern makes surgical removal very challenging and allows the cancer to progress rapidly. Another factor is how late it is usually diagnosed. The early symptoms of mesothelioma are often vague and resemble common lung conditions like pneumonia or bronchitis. This means many cases are diagnosed only when the cancer has already advanced significantly. The disease can take 20 to 50 years to develop after asbestos exposure, which is the main cause of mesothelioma. By the time symptoms appear and diagnosis is made, the cancer has often spread extensively, making treatment more difficult. The cellular makeup of mesothelioma also contributes to its aggressiveness. It includes different cell types, with sarcomatid cells being particularly fast-growing and invasive. Tumors with more sarcomatid cells tend to be more resistant to treatment and grow more quickly. The biphasic type, which contains both epithelial and sarcomatid cells, can vary in how aggressive it is depending on the ratio of these cells. Asbestos exposure plays a key role in the development of mesothelioma. When asbestos fibers are inhaled, they cause chronic inflammation and damage DNA in mesothelial cells. This ongoing injury leads to genetic mutations that promote uncontrolled cell growth. The persistent inflammation creates an environment that favors the development of aggressive tumors. Treating mesothelioma is also difficult because of its growth pattern and location. The widespread involvement of the pleural lining makes complete surgical removal nearly impossible. Radiation and chemotherapy can help control symptoms and slow progression, but they are often less effective because the tumor tends to resist these treatments. This resistance, combined with the advanced stage at which many cases are diagnosed, results in a poor prognosis. In summary, mesothelioma's aggressive nature comes from its origin in the lining around the lungs, its tendency to grow diffusely and invade nearby tissues, the rapid growth of certain cell types, the damaging effects of asbestos fibers, and the challenges in early detection and effective treatment. All these factors make mesothelioma a particularly formidable lung-related cancer. If you suspect exposure to asbestos or experience symptoms like persistent chest pain or breathlessness, it's crucial to consult a healthcare professional for personalized advice and early diagnosis.